Hi everyone, my name is Dr. Curtis Lehmann. I'm an associate professor in the Department of Psychology, and I'm excited to share with you about the role of coronavirus anxiety in suicidality during the pandemic. This is a project that I've been collaborating on with a graduate student of mine, Lauren Giles, who's in our Master's in Research Psychology and Data Analytics program. So I'm excited to share with you. So early on in the pandemic, it became really apparent that the problem of suicide was increasing. The number of calls to the suicide prevention hotline were increasing dramatically. There was news reports of healthcare workers dying by suicide, and you could see there was a number of different news articles and reports that were looking at this and recognizing that the pandemic was putting not only our physical health in danger, but also our mental health. And so the role of the pandemic in increased suicidality is pretty actually far-reaching. If you unpack it, you realize there's a lot of different ways that we've been impacted by the pandemic and the public health response to it. So the reasons for the increased suicidality were actually really complicated and multiple. There was, of course, social distancing, which took us out of our routines and led to less contact with our loved ones and our friends. There was employment losses and furloughs. And the financial stresses that come with that. There was the trauma of healthcare workers who are having to risk their lives to care for people in need. There was the stress for students and employees, childcare challenges, loss of family and friend support, the loss of hobbies and coping strategies. Grieving became more difficult. For those who had a funeral of a loved one, they often encountered reduced sizes of their funerals, and that had implications on the grieving process for them. Substance use problems, even increased firearm purchases. There was just a whole host of ways that the pandemic has increased risk of suicide. But I want to focus in on one component that I think is pretty important for the increased risk of suicide, and that is coronavirus anxiety. So some people experience really significant and severe anxiety about the coronavirus. They can even feel lightheaded. They might have difficulty sleeping or difficulty eating. They might feel frozen in fear or have stomach problems and feel nauseous. And all of that is referred to as coronavirus anxiety, but it can also be referred to as coronaphobia. And coronavirus anxiety, the early studies on it, just last year, of course, found that it was related to increased suicidal ideation. It's also related to a whole host of other problems. Functional impairments, not being able to manage daily tasks and work. It was related to negative religious coping, feeling like God was punishing them or was trying to harm them in some way. It was even related to the alcohol and drug coping. And so, again, I think that this is an important facet of suicidality during the pandemic that we should be careful and look more in depth about. And yet I, as a researcher, want to take a theoretical framework. I don't want to just simply identify that there's a relationship there between the coronavirus anxiety and thoughts of suicide or suicidal behavior. I want to think about it in its context and in the theories that we have to help explain it. So on one level, on a fairly simplistic level, you can understand that anxiety leads to stress. Stress leads to feelings of being trapped or feelings of hopelessness. And suicide, we know, can be an attempt the desire is usually not to take one's own life, but to escape from that feelings of hopelessness and feelings of being trapped, the psychological pain that people feel. And so I'd like to unpack that a little bit further and share about how coronavirus anxiety might actually relate to an existing theory of suicide called the Interpersonal Psychological theory of suicide. And this theory has become extremely popular. It has really opened people's eyes to the way that suicide functions and how it puts people's lives at risk. And it really argues that the desire for suicide is composed of two psychological states. The first one is called thwarted belongingness. That's a bit of a mouthful, but it basically means that you want to belong, you want to feel like you're connected to other people, but you just feel like you can't. And the second part of it is perceived burdensomeness. This is the feeling or the belief that you're a burden on other people. Of course, that's not necessarily true for people, but they believe it to be true. And so the IPTS, the Interpersonal Psychological theory of suicide, argues that's the reason why people want to take their life. They feel like they don't belong and they feel like they're a burden. But the unique part of this theory is that it says it's not just the desire for suicide that leads people to act upon it. The desire isn't sufficient to lead to a suicidal action like a suicide attempt. The theory argues that you have to have the desire, but also a capability for suicide. Suicide is scary, and it goes against our instincts for self-preservation. And so to be able to overcome those instincts, to be able to take one's own life, it does require some things of the person. First off, it requires them to get over their fear of death. So they have to be fearless about death. The second thing that this theory argues is that you have to have tolerance for pain, because suicide is typically a painful act. And so the theory says this is the additional component that was missing before when we thought about suicide, is we have to recognize that it's hard to engage in these things, right? We don't want to uphold that as a good thing, but we need to recognize that it just is hard. And so I want to take that theory and apply it to coronavirus anxiety. And that theory has ushered in a whole host of other theories that have taken some of these ideas and expanded upon them, and they're called the Ideation to Action framework. In this framework, the idea is that suicidal thoughts have their own causes, and they're separate from the causes of suicidal behaviors. Of course, generally, you have to have the thoughts to have the behaviors, but they are caused by different processes. And so you could see here in this chart that the presence for the desire for suicide is when you feel like you don't belong, you have thwarted belongingness, and you have a combination with perceived burdensomeness. I am a burden. So that's when that desire for suicide occurs. But again, the capability for suicide is important. Now, some people have capability for suicide but don't actually have any desire for suicide, fortunately. And for those, there is no action that they will take. But for those who have that combination of desire for suicide and capability for suicide, that's when you have lethal or near lethal suicide attempts. And certainly that is something that we should be mindful of and try to work to prevent. Now, in regards to coronavirus anxiety, there's a few key questions. Really, basically, it's where does coronavirus anxiety fit into this theory, into this model? Is coronavirus anxiety associated with increased thoughts of suicide? Well, we know from some past research that it definitely seems like it is. And if so, well then why? Is coronavirus anxiety increasing thwarted belongingness, keeping people from that sense of belonging with other people? Or is it related to the perception that I'm a burden, the perceived burdensomeness? Or of course, could it be both? So that's a key question, and that's related to the desire for suicide. But then for the suicidal behaviors, for the capability for suicide, how is it related to those behaviors? Is it leading to increased capability for suicide? And then finally, one thing we're going to look at is whether coronavirus anxiety is a specific and special type of anxiety, or does it just fit within the general type of anxiety, and it just manifests itself in that form. Okay, so I'm going to share with you a study that we conducted in October. We designed an online study that would measure these aspects to see if there were links between them. And so participants were recruited from Amazon's MTurk. You may not know MTurk. It's basically a platform online where people will get paid small amounts of money to do tasks. And researchers have taken this up and said, well, we can give people surveys. And so we designed a survey that took about 5 to 10 minutes to complete, and we recruited participants from this platform to participate. And we actually were able to acquire 393 participants. And I'll give you a little bit of details about the sample. About 58% were female. The average age was 41.2. And you could see there in the graph for age that it's pretty well distributed, although the main grouping is people in their 30s, but it did range from 19 to 77. The sample was majority Caucasian, so 72% were Caucasian, so not terribly diverse, with Asian American Pacific Islanders at about 12%, African American at 8%, Latinx at 4%, multiracial about 2%, Native American at 1%, and other was about 0.5%. Most participants, we know that sexual orientation can be really linked to suicidality. Most participants identified as straight or heterosexual with 87%, and the bisexual about 7.8%, gay, lesbian, or same gender loving at 2.3%, and not listed 1%, and finally declined to answer 1%. So that's a little bit of who we were surveying, who we were looking at. Now, what did we look at? What were the study measures? So we asked participants a few questions. We first asked them about their suicidal ideation and behaviors. And we asked them about their past 6-month suicidal ideation and behaviors. And there's a key thing to know. We conducted this study in October 2020, which was about 6 months after when things really got shut down. So if you recall, it was in March 2020 that a lot of states and most places in the United States at least really shut down, and you really felt the pandemic occurring. And so we were asking them about the 6 months prior because it really overlapped well with that time frame. And so we asked them about their ideation and about their behaviors, such as suicide attempt and self-injury. And then we asked them about thwarted belongingness and perceived burdensomeness. There was a 15-item interpersonal needs questionnaire. There was the coronavirus anxiety scale. It's a 5-item scale. And the generalized anxiety disorder symptoms with the GAD-7. We had some other questions, but I won't go over it for this. So what did we find? Well, first off, it's important to just look at how often are people thinking about suicide and how often are people attempting suicide. So in our sample, I like to point out that we recruited people to a study that had suicide in the name. So I wouldn't imagine that this is really representative of suicidality in the population as a whole. So take it with a grain of salt. But we did find in our sample that about a third had thought about, had a wish to die or a wish to fall asleep and never wake up. We call that passive suicidal ideation. So a lot of people are thinking about death. And about 21% are thinking actually about taking their own life. So we call that active suicidal ideation, SI. Then we have SI with method, which is you think about suicide and you actually think about how you might do it. We had 14.4% thinking at that degree of severity. With intent, 6.8%. So this is having these thoughts and having some intention of acting upon them. And then finally, suicidal ideation with a plan associated with it. About 4% of our sample were thinking about suicide and actually had come up with a plan or started to come up with a plan for how they were going to do this. So certainly suicidal ideation was a concern with this sample. In terms of suicidal behaviors, I look at this as a good thing. We only found 2 of the 393 participants who had actually attempted suicide in the past 6 months. So that's about 0.5%. So fortunately, we're not finding strong evidence that there's a large number of people attempting suicide. However, that's a little bit of a challenge when we're trying to understand what role does coronavirus anxiety play in suicidal behaviors like suicide attempts. And so what we did is we combined together those who attempted suicide along with those who engaged in an interrupted or an aborted suicide attempt. Now, you may not be familiar with those terms, which of course is quite possible, but an aborted suicide attempt is where you began preparing for an attempt, but you decided not to on your own. So this is where they've started a suicide attempt, but they decided, no, I don't want to do this. So they obviously have some action that they've taken. The interrupted attempt is where they started to attempt suicide, but someone else or something interrupted them. And so, of course, fortunately, these people did not carry out in their suicide attempt. And so we combined them all together and looked at them as a whole to look at those who had attempted, aborted, or interrupted suicide attempts. And what did we find? Was coronavirus anxiety related to thoughts of suicide? Yes. You could see here that there's a correlation between coronavirus anxiety and level of suicidal ideation. So the level of suicidal ideation is how severe their ideation is, from passive to all the way to suicidal ideation with a plan. So there's a correlation there. It's clear that they're connected. And the R-squared, if you don't know what your stats or not too familiar with it, of the R-squared of 0.07 says 7% of all the variants in terms of thoughts of suicide are connected to coronavirus anxiety. So, of course, that's not all of it, but it's a sizable minority of thoughts of suicide are connected to coronavirus anxiety. Secondly, we have down here that coronavirus anxiety was connected to suicidal behavior. So those who have higher degrees of coronavirus anxiety are much more likely to attempt a suicide. Of course, this includes aborted attempt and interrupted attempt. And so the R-squared there is 0.11. 11% of suicide attempt variance is due to coronavirus anxiety. That's a big deal. But the goal of this study wasn't just to look at how it relates directly to coronavirus anxiety and suicide. It was to unpack it a little bit. It was to try to understand what else might be going on behind the scenes. And that's where these constructs, thwarted belongingness and perceived burdensomeness, come in. We wanted to know, is coronavirus anxiety causing suicidal ideation because it makes people feel like they don't belong? Or is it because it makes them feel like they are a burden? Or is it both? So our findings were that it was significantly related to both. That it was related to thwarted belongingness and to perceived burdensomeness. Now, the correlation with thwarted belongingness, you could see here, it was R equals 0.16, a correlation of 0.16. That's actually a fairly weak correlation. So it doesn't seem to be severely impacting people's feelings of belongingness. So I was thinking about it and saying, okay, what might be going on there, right? Because anxiety tends to make people feel a little bit more isolated. But I was like, well, maybe, this is just a thought, but maybe it also bonded them to others who were anxious about coronavirus. And so one possibility is that some people might feel a greater sense of belonging because they connect over their anxiety. That's just an idea, possibility. But in general, it is related to less feelings of belongingness. But what seems to be more important is its relationship with perceived burdensomeness. So the correlation there was 0.32, twice as big. And that suggests that when people have anxiety about coronavirus, for whatever reason, they start to feel like a burden. They start to think that other people's lives would be better if I were dead or if I were gone. Okay, and that seems to be the real cause of what might be going on in how coronavirus anxiety is increasing thoughts of suicide. Finally, the other major analysis we did was saying, okay, is coronavirus special? Is it doing anything unique? And for the large part, what we found is no, not really. We looked at how it connects to general anxiety. So again, the question is coronavirus anxiety linked to suicidal ideation simply because people who worry about coronavirus are just worriers in general, and they have a lot of anxiety? That certainly seems possible. And when we controlled for generalized anxiety, coronavirus anxiety was no longer significantly related to suicidal ideation, and it was no longer related to suicidal behavior. So that kind of suggests that no, it's not really all that special. But what we think might be happening is that coronavirus anxiety actually makes people generally anxious. It's a specific type, but we think that if we studied it more, if we studied with correlation or longitudinal research as opposed to correlational, we'd probably find that people who start to worry about coronavirus, they probably get to be more generally anxious in the long run. So we do take this as evidence that yes, general anxiety seems to be more important. If you're focusing on identifying who is going to attempt suicide or who might be thinking about suicide, general anxiety is probably the place to focus. But still, coronavirus anxiety is important. Okay, so in research, we present the results, but then we discuss them. So let me share a little bit my thoughts on these findings. So what did we find? Coronavirus anxiety is moderately related to both suicidal ideation and suicidal behavior. Although we're not able to establish causation because of the research design, it appears that coronavirus anxiety is a risk factor for both suicidal ideation and suicidal behavior. The link is partially, but not fully explained by the higher levels of general anxiety among those who are anxious about coronavirus. Okay, that's the big takeaway. But when you get underneath the surface, you go a little deeper, you realize that the link between coronavirus anxiety and suicidal ideation, it seems to be particularly due to increased perceptions of being a burden. Now, as we thought about this, we were really unsure. What is it about being anxious that makes people feel like a burden? Well, we thought about it and said, okay, maybe it's that they worry about getting infected and falling ill with COVID-19. Right? That is something that people are really worried about. So that could lead them to be afraid, if I get really ill, if I have to go to the hospital, and God forbid I die, how would that affect my family? That could lead to that sense of burden. Another possibility is that when you have anxiety about coronavirus, a lot of it might be actually due to your concern about transmission. Maybe you're not personally worried that you're going to fall seriously ill with COVID-19, but maybe you're worried that you're going to transmit it to someone who does. And maybe you're worried that you're going to transmit it and that person might have to be hospitalized or might die from from COVID-19. So that could be the reason. We don't know just yet. But we do know, again, that it's increasing levels of perceived burdensomeness. There is also a link, but not quite as strong, with thwarted belongingness. And again, it seems to be the result, a possibility is that it could be the result of greater social distancing. That when you are anxious, you're probably isolating, and people probably feel it. They pull away from others for safety reasons, but then they feel lonely and disconnected. Now, all of that had to do with relating it to suicidal ideation. What about suicidal behavior? Well, this is where I think it's really interesting because you have coronavirus anxiety, a fear about one's own health. In fact, maybe even a fear of one's own safety and well-being and physical health. Now, it seems a bit paradoxical that a person who's really worried about their health would be thinking about or even attempting suicide attempts. And that it makes more sense when you realize that coronavirus anxiety has been linked to death anxiety. But we know that fear of death, especially fear of death connected with panic attacks, are related to suicide attempts. Again, it sounds backwards. Why is a person who is afraid of death more likely to attempt suicide? It makes more sense, and the interpersonal psychological theory of suicide has mentioned this, that when you think about something over and over, you can actually become desensitized to it. And it can actually lead to an attempt to try to control your own death through suicide. And so the research suggests that that could be a factor there. Again, that even though a person's afraid of death, they're counterintuitively attempting suicide. The other factor is that insomnia is one of the symptoms of coronavirus anxiety, and it may have an important role in suicidal behavior. So some research has shown that insomnia is actually a characteristic of people in a suicidal crisis state. And so if you start to have insomnia, it might actually impair your reasoning and may make you feel a little bit more distressed and could lead you to attempt suicide. So again, these are all possibilities, but things that should be looked into in the future. Some more future research. It really just I think we need to unpack this further. Why are people feeling like a burden from coronavirus anxiety? Again, is it one's own infection and illness? Is it about infecting others? Or is it just general concerns about the pandemic? So of course, what do you take away from this talk? First of all, I hope that you take away that if you know someone who's really worried about coronavirus, have a conversation with them. Ask them if they're thinking about suicide. It may seem kind of invasive, it may seem kind of like a big question to ask a person, but most people, when they're asked, they experience it as caring. And even if they're not thinking about suicide, you've gotten a conversation started with them on their mental health. You can encourage them to see a therapist, or you can encourage them to engage in some more positive coping behaviors. So that would be wonderful. Secondly, I also want to make sure that you recognize that the goal here is not eradicating all anxiety and worry. I'd say instead, the goal should be managing anxiety. The fact is that more than 500,000 Americans have died of COVID-19. That's an enormous number of people. Coronavirus is something to take seriously. It can impact the lives of yourself or those that you care about. But really, it's making sure that that anxiety results in positive behaviors and doesn't tear that person down. It doesn't become so dysfunctional and overwhelming that they're just not able to manage their life. So the encouragement is use that concern and worry for positive things and try to control control it from getting out of hand. I'd like to point out that the CDC recommends the following, and you've probably heard this before, but I just want to echo it, that it's important to wear a mask, to stay 6 feet away from others, to wash your hands often, and finally to cover your coughs and sneezes. All of that is appropriate worry, appropriate anxiety that can help keep people safe. So, in conclusion, I hope you enjoyed this talk. I hope that you go out and if you know someone struggling, you have a conversation with them about their mental health. In fact, maybe even ask them if they're thinking about suicide. Lastly, I just say, be safe and care for one another. Take care.